The focus is on health providers and human rights. This is a vital topic that considers the significant role of health providers within a human rights context. In-depth knowledge and understanding are crucial, which is what the KP provider training is aimed to deliver. It is critical information for all involved in healthcare. Our focus is to comprehend the vital role of healthcare providers in preserving human rights and health rights. Additionally, we'll delve into the ethical responsibilities and practical approaches that aid in delivering patient-oriented care to every population, particularly those on the margins of society. Our focus today is set on two crucial health objectives. Firstly, we aim to decipher and understand the obstacles preventing equitable healthcare access for crucial populations and marginalized groups. Secondly, we aim to show methods for implementing person-centered care principles in daily clinical practice. These objectives are central to our drive for improved healthcare. In this session, we focus on understanding two specific educational goals. Firstly, we aim to enable learners to recognize the origins of disparity and unfairness in healthcare systems and comprehend how this affects patients. Secondly, our objective is to equip learners with the ability to incorporate the principles of the Patient Charter in their patient interactions, ensuring respect, dignity, and fairness for everyone involved. Let's delve into understanding the fundamental human right, the right to health. It's vital to realize the right to health goes beyond mere access to medical care. It encompasses two key elements. First, availability. This involves ensuring that there are enough functioning public health facilities, services, and programs for everyone. Secondly, accessibility, which demands healthcare to be physically, economically, and culturally accessible to all individuals. This includes comfortably approachable clinics for those in remote areas or with disabilities, as well as affordable services for everyone, particularly the marginalized and disadvantaged. Healthcare is a fundamental right, and it's imperative that it's provided without discrimination, regardless of one's age, gender, sexual orientation, and socioeconomic status. It's equally necessary that all healthcare facilities uphold medical ethics, ensure cultural appropriateness, and maintain patient confidentiality and sensitivity. Moreover, the quality of services should meet medical standards, with adequate personnel, safe medication, and suitable facilities. The realization of the right to health is riddled with challenges. Some of these include structural barriers, where infrastructure deficiencies limit access to health facilities. Economic inequalities, such as poverty, restrict people's capacity to pay for care, medication, or transportation to healthcare facilities. Discrimination also plays a part. Unjust biases against certain groups in society work as obstacles, instilling fear, stigma, and ultimately exclusion from care. Healthcare providers play a crucial role as gatekeepers to health rights. Their conduct with patients should be respectful and non-judgmental to maintain the patient's trust and ongoing care. Dismissiveness can deter individuals, such as young women seeking contraception, from future medical assistance. Patients' confidentiality is paramount, particularly in high-stigma environments. Providers can also vitalize the system by advocating for institutional changes to align with health rights. The Patient's Charter highlights three fundamental principles. The first focuses on dignity, encouraging healthcare providers to see beyond the medical condition and recognize the individual's humanity. The principle of fairness advises against allowing personal biases to impact care delivery. Lastly, open communication emphasizes the importance of speaking to patients in an understandable way and involving them in the decision-making process. The concept of do no harm in ethical practice extends far beyond avoiding physical injury. Emotional harm can be inflicted through judgmental attitudes, dismissive words, or negative body language that may dissuade patients from seeking healthcare. Neglect can lead to critical health ramifications, such as undiagnosed ailments, untreated ailments, particularly in marginalized groups, like the LGBT community and sex workers. Structural harm is inflicted when healthcare systems lack appropriate accommodations, like ramps, for wheelchair users. Such oversights implicitly marginalize and exclude certain populations. The concept of person-centered care is considered the gold standard in medical practice. It emphasizes on three substantial elements: empathy, respect for choices, and a holistic approach. Here, the emphasis on empathy means understanding patients by listening to their stories and contexts. Moreover, respecting people's choices entails allowing patients to make well-informed decisions about their care that align with their beliefs, even if it opposes the provider's recommendations. Lastly, the holistic approach encapsulates the consideration of social, mental, and emotional aspects of health, in addition to physical. We're diving into the concept of person-centered care, the gold standard in healthcare. We're examining examples of this practice in action. The first example illustrates active listening, where a teenager seeking contraception can express her concerns and queries without interruption or bias. The second example demonstrates shared decision-making. Here, a healthcare provider and a patient discuss the advantages and disadvantages of different treatment options, respecting the patient's right to choose the most suitable for their conditions. Key populations such as sex workers, drug users, and disabled individuals frequently confront systemic and societal obstacles to healthcare. They encounter stigma and discrimination, which often excludes them from care. Legalities that criminalize behaviors, like same-sex relationships or drug use, can also prevent them from seeking healthcare. Accessibility challenges, including the absence of amenities necessary for wheelchair users or hearing-impaired individuals, are additional barriers they face.